Hello guys and welcome. My name is Dr. Peter and today we're going to be discussing how to clerk diarrhea. Of course, in the exam situation, use close-ended questions. This will save you time. Also use lay terms that the patients and the relatives can relate to. And if you are a clinical student who is interested in examination stations, picture tests, and what you will need when preparing for a clinical exam, then do well to subscribe to this channel and watch out for more of our content. Diarrhea is increase in the frequency, the fluidity, and the volume of bowel movement of an individual. So having this in mind, you can now ask the questions to know if the patient has diarrhea. These are the questions you would like to ask. You want to know how long the patient has been having diarrhea, having in mind the 14-day mark, which would differentiate between acute diarrhea and chronic diarrhea. It's also important for you to know how many episodes per day relative to the patient's normal bowel habit. It's also important to know the volume of each episode and then the content. The content because bloody mucus stool will point towards dysentery. Red currant stool will point towards intussusception. Rice water stool will point towards cholera. Now, pale, offensive, bulky, difficult to flush stool will point towards obstructive jaundice. Now, pellet-like stools with or without mucus will point towards inflammatory bowel disease. You also want to know if the patient has been falling frequently ill with weight loss, which will point towards an immunocompromised individual, such as individuals with HIV. If the patient is on any drugs, for example, laxatives, it might point towards that being the cause of the diarrhea. Now, these questions will characterize the diarrhea. You also want to ask questions surrounding the food hygiene. Does the individual patronize food ventures? Does he wash his hands before and after the use of the toilet? What is the method of sewage disposal? What is the source of drinking water? And you want to also ask if the relatives or people who ate the same meal with the individual have also had similar symptoms. It's also important to know the 24-hour dietary recall before the patient started having diarrhea. An individual who has been abusing antibiotics might have pseudomembranous colitis, for example, from excessive use of metronidazole. Now, the complications surrounding diarrhea could include a reduced urinary output, which will point towards, for example, an acute kidney injury, also altered mental status or seizures from this electrolytemia. These are the questions that will help you to characterize and describe diarrhea with associations. Thank you guys for listening and watch out for more of our content.